So now the Watchman device is an interesting device. This is for patients with atrial fibrillation. So atrial fibrillation is a very common condition, particularly as patients get older. Those patients that have congestive heart failure, high blood pressure, age over the age of 65, diabetes, and females have a higher risk of developing a stroke when you have atrial fibrillation. This device is called a Watchman device. And there's a new version of this device, which we have at Stanford, which is a device that we implant through a minimally invasive approach through a vein in the leg and attempt to put it into the heart to reduce the risk of stroke. The advantage of this is that once implanted successfully in over 90% of patients, there is no longer a need to take blood thinners in order to prevent the stroke. And that's very important for elderly patients who are at high risk of bleeding, whether it's because of impaired kidneys, because of frequent falls, or simply because of advanced age. So what you see here is this area called the left atrial appendage. And because of low blood flow, blood clots can form in that area. And those blood clots can migrate to the brain and catastrophically cause a stroke. So this procedure is done under general anesthesia, typically under an hour, and the hospital stay is 1 day. In our experience at Stanford, the procedure time is about 30 minutes, and I actually discharge the patients the very same day, so it's a day procedure. I navigate through a little incision in the vein up to the right side of the heart, as you can see here in this animation, and then making a very small hole from the right side of the heart, crossing into the left side of the heart. We advance a catheter over very small wires. So this is in complete contrast to any open heart procedure. Through these little catheters, we're able to navigate into this pouch called the appendage, where a lot of these clots reside. And then very carefully, we place this Watchman device, which you can see there, basically blocks off or occludes that area. The device grows over with the heart's healthy tissue. And what that means is that there's now a mechanical barrier to prevent those clots that form in that area from shooting out and potentially going to the brain and causing a stroke. So you can imagine that this has been a significant advantage for patients. You need to stay on blood thinners for just 6 weeks. And after that, all you need to take is a baby aspirin lifelong. And it's a very safe and effective procedure. So it's been around for a long time, since 2005. There have been multiple clinical trials performed. And in all of these trials, they've had excellent clinical outcomes, excellent safety profiles. As I said, the procedure now takes about 30 minutes in experienced hands, and we're sending all of our patients home the same day. It's successful in over 90% of procedures, and most patients, I would say above 95%, are able to come off their blood thinners after that 6-week period. Blood thinners do work in the vast majority of patients, and they work well to prevent strokes. However, that group that you mentioned, those above 80, by virtue of their age, already they're at a higher bleeding risk. Now, if you add in the fact if they're females, if they're small, meaning low body weight, if they have any kidney problems, and if they've had a high risk of recurrent falls, or they're at high risk for fall, they all fall under the umbrella of high bleeding risk. And in those patients, that risk-benefit ratio of the blood thinner starts to shift in towards a higher risk, less benefit. And so I think that group of patients, just as the first group, is great for Watchman. If I say a percentage that are eligible, I would say 40% of patients above 80 who have atrial fibrillation would be off the bat candidates for the Watchman procedure.